Welcome to the NCCDH webinar entitled Live in Health Equity Values Within Public Health Organizations. My name is Sume Ndumbe-Eyoh, and I'm going to be your host for today's webinar. Thank you all for joining us today. Today's webinar is part of a webinar series we have been doing through our Organizational Capacity for Health Equity Action initiative, which I'll speak to a little bit further into the presentation. On the line with me is my colleague Asha Kortete, who is a Knowledge Translation Coordinator with the Center, and you'll see her in the chat box throughout today's webinar, and you all received emails from her in advance of today's webinar. The NCCDH, your host for today, is located in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. And I'm speaking to you today from Toronto, which is the traditional and unceded territory of the Haudenosaunee, the Wendat, the Anishinaabe, and the treaty holders in Toronto are the Mississaugas of the New Credit River. I think as we talked about organizational values today and what it means for us to live values within organizations, it's really important for us to think about some of the societal factors which affect what we consider our organizational values. So as I give this land acknowledgement, I'm really recognizing the fact that they are very distinct cultural views of values, which in our discussion will be really great for us to surface those. The National Collaborative Center for Determinants of Health, as many of you on the line know, focuses on working with practitioners, organizations, and researchers within the public health system to support knowledge translation related to health equity and the social determinants of health. We are part of a network of 6 NCCs, and we all focus on a different area of public health capacity. I know some of my colleagues from the National Collaborative Center for Methods and Tools are on the line. We have the National Collaborative Center for Aboriginal Health, Environmental Health, Healthy Public Policy, and Infectious Diseases. You can learn more about all the NCCs by going to NCCDH.ca, and that will link you to both the NCC program as well as the individual centers. So today we're going to be talking about health equity values within organizations, and our objectives today are really to talk a little bit about what kinds of values reflect health equity practice. We'll also talk a little bit about the kinds of tools we can use to assess values within our organizations, as well as a discussion on some strategies to shift values. Toward the end of our presentation, we'll share some examples about how others in the field are thinking about these issues. I am pleased to be one of your presenters today in collaboration with Dr. Claire Betker, who is our new Scientific Director at the National Collaborative Center for Determinants of Health. Claire joined the NCC as Scientific Director in March of this year, and it's a real pleasure for me to be on the call today with Claire. I think this is her first webinar as Scientific Director. Many of you may know Claire, who was at the Center before as a Senior Knowledge Translation Specialist. Most recently, she was the Acting Executive Director of Population and Public Health in Manitoba Health, Seniors and Active Living. Claire is a registered nurse, and I think she'll bring a lot of that into our discussion today, and is currently President of the Canadian Nurses Association and a past President of the Community Health Nurses of Canada. So thanks for being here,